4 benefits of garlic for heart and blood vessel health. Garlic has long been recognized as one of the most powerful natural remedies for cardiovascular health. Throughout history, it has been used not only for its distinctive flavor, but also as a protective agent for the heart and circulatory system. Modern research confirms what ancient medicine long suggested. Garlic contains a unique combination of biologically active compounds that support vascular health, improve blood flow, regulate cholesterol, and enhance overall heart function. Garlic becomes especially significant after the age of 45-50, when the first signs of vascular aging begin to appear. At this stage, arterial walls lose elasticity. Cholesterol plaques start to form. Blood pressure tends to rise, and the heart faces increased strain. Incorporating garlic into the diet can provide a gentle but meaningful support to the circulatory system, helping maintain cardiovascular health and reducing the risk of complications such as atherosclerosis, hypertension, and thrombosis. This article explores in detail how garlic benefits the heart and blood vessels, the key compounds responsible for these effects, and practical recommendations for including garlic in your daily nutrition. Why blood vessels age? Changes after 40-50 years. To understand the value of garlic for heart health, it is essential to grasp why blood vessels start to function less effectively with age. 1. Loss of elasticity in blood vessel walls. With each passing decade, the walls of arteries and veins become thicker, denser, and less flexible. The production of collagen and elastin, proteins responsible for elasticity, gradually decreases. Additionally, chronic low-level inflammation accelerates arterial stiffening. Consequences: blood pressure slowly rises, increasing cardiac workload. Blood flow efficiency decreases, affecting oxygen delivery to tissues. Risk of developing hypertension and cardiovascular complications increases too. Accumulation of cholesterol plaques. As people age, lipid metabolism slows down. LDL, bad. Cholesterol is more likely to deposit on arterial walls, forming plaques. Over time, these plaques can grow, leading to partial or complete blockage of blood vessels. Consequences: narrowing of the arterial lumen reduces blood flow to vital organs. Increased risk of heart attacks, strokes, and peripheral artery disease. Formation of thrombosis-prone zones in vessels. Blood pressure rises as the heart works harder to pump through narrowed arteries. 3. Chronic inflammation. Even mild chronic inflammation contributes significantly to vascular aging. Small tears or micro-damage in the endothelium, the inner lining of blood vessels, attract lipids and white blood cells, accelerating plaque formation and vascular stiffness. 4. Decline in nitric oxide, NO, production. Nitric oxide is a vital signaling molecule that helps arteries relax and maintain proper blood flow. After age 50, the natural production of NO declines, reducing the ability of vessels to dilate. Consequences: higher blood pressure, increased cardiac workload, greater risk of developing hypertension-related complications. 5. Blood viscosity increases. Blood tends to thicken with age due to changes in plasma composition and platelet function. Thickened blood circulates less efficiently and is more prone to clot formation. In this context, garlic proves to be a particularly valuable dietary component, as it helps address many of these age-related cardiovascular challenges. Property number 1. Garlic lowers cholesterol and cleans blood vessels. One of the most extensively studied effects of garlic is its ability to improve lipid profiles and prevent plaque formation. Key compound: allicin forms when garlic is crushed or chopped, initiating a biochemical cascade that influences cholesterol metabolism. Benefits of allicin: lowers LDL, bad. Cholesterol reduces triglyceride levels. Prevents LDL oxidation, a key step in atherosclerosis development, increases HDL, good. Cholesterol. Prevents lipid buildup on arterial walls. Scientific evidence. Research shows that regular garlic consumption can reduce LDL cholesterol by approximately 10-15% over a period of 4 to 12 weeks. While the effect is gradual, it is cumulative and meaningful in reducing long-term cardiovascular risk. Why it matters? Oxidized LDL is the primary substance forming atherosclerotic plaques. By preventing LDL oxidation and promoting healthier lipid levels, garlic helps clean blood vessels and improves their function, supporting overall cardiovascular resilience. Practical tip: for best results, consume raw or lightly crushed garlic, as cooking can reduce the allicin content. 1 to 2 cloves per day is generally considered beneficial for cardiovascular health. Property number 2. Garlic dilates blood vessels and lowers blood pressure. High blood pressure is a major risk factor for heart attack, stroke, and kidney disease. Garlic supports blood pressure regulation by improving vascular function and enhancing nitric oxide availability. How garlic helps: stimulates NO production, relaxing vessel walls, reduces vascular resistance, improving blood flow, decreases arterial spasms and stiffness, supports healthy endothelial function. Scientific findings: regular garlic consumption can reduce systolic blood pressure by 7 to 10 mmHg and diastolic pressure by 4.6 mmHg, an effect comparable to mild antihypertensive medications but without the side effects. Importance after 50. As arteries become stiffer with age, the heart must pump harder to maintain circulation. Garlic helps vessels remain more flexible and reactive, reducing cardiac stress and supporting stable blood pressure. Practical tip: crushed raw garlic or aged garlic extracts can be taken daily. Consistency is key, as the hypertensive effect builds over weeks. Property number 3. Garlic thins blood and prevents clots. Aging often brings increased blood viscosity and a higher risk of thrombosis. Garlic naturally acts as an anticoagulant, reducing clot formation without overly increasing bleeding risk when used moderately. Benefits: reduces platelet aggregation, improving blood flow, prevents formation of clots in arteries and veins, supports circulation in high-risk conditions like varicose veins, sedentary lifestyles, or hypercholesterolemia mechanism. Sulfur-containing compounds, such as arginine, promote the production of substances that inhibit excessive platelet activity. This is why garlic is sometimes referred to as natural aspirin. Important note: people taking prescription anticoagulants should consult a healthcare professional before consuming large amounts of garlic to avoid excessive blood thinning. Property number 4. Garlic reduces inflammation and protects the heart. Muscle chronic inflammation is a silent driver of vascular aging. Garlic's anti-inflammatory and antioxidant properties help protect both the heart and blood vessels. How it works: neutralizes free radicals, reducing oxidative stress, lowers inflammatory markers in the blood, protects endothelial cells from damage, supports overall immune function. Heart benefits: reduces cardiac workload by improving vascular efficiency, enhances oxygen delivery to the myocardium, slows vascular aging and plaque progression, reduces risk of heart failure and ischemic events. Extra insight: endothelial health is crucial. Damage triggers plaque formation and arterial stiffness. Garlic supports endothelial repair and resilience, contributing to long-term cardiovascular protection. Key compounds in garlic that make it so powerful. Garlic is a natural biochemical factory, producing multiple compounds that synergistically benefit heart and vessel health. Main components: allicin, antibacterial, anti-inflammatory, and vascular supportive arginine. Inhibits platelet aggregation, reducing clot risk. Diallyl disulfide improves vascular wall function and elasticity. Selenium protects against oxidative stress. Flavonoids, potent anti-inflammatory action. Vitamin C supports immunity and tissue repair. Biochemical note: when a garlic clove is crushed, alliin is converted into allicin, the active compound responsible for most cardiovascular benefits. The enzymatic reaction begins immediately, which is why freshly crushed garlic is more effective than processed or heavily cooked forms. How to include garlic in your diet. 1. Raw consumption. 1 to 2 cloves daily, crushed or finely chopped. 2. Cooking tip. Add garlic at the end of cooking to preserve allicin content. 3. Aged garlic extract. Convenient and potent, with reduced odor but similar cardiovascular benefits. 4. Combination with other heart-healthy foods. Pair garlic with olive oil, leafy greens, and omega-3 rich foods for synergistic effects. Safety note. While garlic is generally safe, excessive intake can cause gastrointestinal discomfort or interact with certain medications, particularly blood thinners. Always consult your doctor if you have chronic conditions or take prescription drugs. Garlic is more than just a flavorful seasoning. It is a natural ally for the heart and blood vessels. Regular, mindful consumption can support cholesterol balance, lower blood pressure, improve circulation, prevent clot formation, reduce inflammation, and protect the heart. By incorporating garlic into your daily diet, you can give your cardiovascular system a gentle but powerful boost, especially after the age of 45-50, when vascular aging begins to accelerate.